We're back right here in the studio, and we have with us right now Dr. Ghanem Alsalem, who is a consultant in internal medicine and gastroenterologist. Good evening, doctor.
Good evening. Hi.
Doctor, very nice to have you with us this evening and taking some time to be with us right here on Hala Kuwait. We appreciate your time.
Thank you very much for having me on this show. It's a great show, and I'm sure that it has its own viewers who are actually following this show regularly on time.
Thank you very much. Doctor, please tell us a little bit. We're going to be talking about reflux. Tell us, what is reflux, please?
Yes, that's a good question, and a good topic to cover. But before we go into the reflux, I would like to just spread my thanks to those who are in the frontliners fighting the coronavirus, COVID-19. As you know, this is the hot topic now in medicine and worldwide, socially, and affecting us economically as well. So
yes, they should be commended for their fine job.
Of course. And these are my colleagues who actually on the front line, who gave their time and helped to help people to get over this.
They're
and
sacrificing a lot.
Get out of this. Yes, thank you very much. So reflux, we go back to our main subject, reflux esophagitis, that's what we call it in medicine, or gastroesophageal reflux disease.
Yeah, what is it?
It's annoying symptoms. The patient feels the acid, the heartburn, going up from the stomach in the esophagus. Let me let you know this. The esophagus has a lining inside. The lining of the inside of the esophagus cannot tolerate the acid. So our body made that the acid only stays in the stomach. Some patients and some people, they have this few drops of the acid going up in the esophagus where there shouldn't be acid. And then the patient or the individual will start to experience this reflux, acidity, pain, and sometimes bitter taste in their mouth. That's what's reflux in general.
So what causes reflux, Dr. Ghanem?
Yeah, there are multiple causes for reflux. There are few simple reasons to have a reflux, and the main one is the lifestyle way. So how you live, how you deal with your meals, how you exercise or you don't exercise, what kind of food you take, and if you have bad habits like smoking or anything like that. Sleeping pattern also affects reflux. The other thing which most patients or most people miss is the sleeping pattern. If you are a person who actually stays up at night, you tend to have more acid produced in the stomach, and that will go up in your esophagus.
Why is that, doctor? Why is it staying up late at night increases the risk of having more reflux?
That's a good question. Yes, because you as a human, we are adapted to our biological clock inside our brain. So you're supposed to sleep during the night time, and that's where you adapt your body to regenerate, take a new energy. So your stomach is not fit to take food during that time. Patients or people who stays up at night, they are alert, they are conscious, they are they feel hungry, they produce more power, and they consume more of energy, so they need more power. Your brain sends electric impulse and information to the stomach to get ready for food. So the stomach starts to produce more acid that's not necessary or cannot be at that time. So instead of producing, for example, few mLs of acid, you'll be producing multiple mLs of acid to expect the food is coming in your stomach, where maybe sometimes there is no food. So that amount of acid inside your stomach makes the pH or the acidity in the stomach really acid. And these drops start to migrate from your stomach up in the esophagus where they shouldn't be.
So it's better than to not eat very late at night also, correct?
Of course. Eating at night. If you have to eat at night, I know, here in Kuwait, for example, we stay up at night. Most of the people actually stay up at night. I advise them, if they want to eat after 9 p.m., they should eat light things or things with water like cucumber, lettuce, something like that, but not cooked food. Because whenever you start to eat cooking food or heavy meal or fatty food during the night, you're definitely going to have acid. Your stomach will produce a lot of acid, and the acid will go up. There are other causes as well can cause the acidity. There are pathological things like anomaly. For example, hiatus hernia, where you have some parts of the stomach actually above your diaphragm, because we have this diaphragm to protect the acid from coming up. So it makes as a gate, stop the acidity to go up. Sometimes some of the patients, they have that hiatus hernia where they lose this feature. So the gate is always open all day, all night. And these people, they will have to take medicine to reduce their acidity. Some of the patients will fail the medicine and they have to go for surgery to correct this. So there are multiple reasons. For example, smoking produces more acid in the stomach and actually can damage the esophagus. And if that happens, then the only thing to stop acidity and stop these symptoms, awful symptoms, is to stop smoking.
Doctor, tell us a little bit, Dr. Ghanem, about the risk factors and what could take place.
Yeah, there are multiple risk factors we always discuss with our patients. So the patient comes to my clinic and says, hey, doc, I have this heartburn feeling. I am not feeling comfortable with my acid. I will tell the patient first, I will dig more in the history. I will start to understand how he lives. I will understand how his lifestyle is going around, what kind of bad habits they have, and also we'll examine the patient clinically. And the most important thing to look into is the weight of the patient. The overweight patients or obese patients, they tend to have more problems with their acid and tolerating the acidity when the acid comes up in their esophagus. That's one risk factor. Right. The other one is, as we mentioned before, the staying at night. Some patients, actually, they have to stay at night because their work tend them to be at night, or they have night shifts, or they have to work during the night and sleep during the day. These people, those people who we have to go through their lifestyle and tell them this is a risk factor if you stay up at night for your work, that you will have to change this to maintain or to control your symptoms. The other thing is that they have other medicines. Sometimes some patients, they have medicine where actually it produces the acid more, like pills for osteoporosis. So these are the risk factors where we have to take into account when we talk to the patient. Other things as well, their bad habits, like as I mentioned, smoking or other things, or lack of exercise. We will encourage patients to stop smoking and to do more exercise. You know what? The more exercise you do, the less acidity you produce. The more exercise you do, the less heartburn you will experience.
Doctor, what are some of the treatment methods then? What treatment do you have?
Yes, so we start first to change the lifestyle of the patient, and that will be our really the turnover or the big play card we play with the patients, is to tell them about where they go wrong during their lifestyle and start to maintain or adapt a new lifestyle. It doesn't come easy. It takes time to change a habit. And as you know, the habits, you spend a lot of time to change them, and we go through them and we talk to them in detail. Other things I will advise the patient to make a food diary. What I mean by a food diary? So there are some certain kind of foods, they produce acid more in you than anybody else. So I will ask the patient to look into their diet and write a note of if they feel or experience this acidity more with a specific kind of food, for example, with tea or coffee or chocolate or sometimes with cheese. So they will write a list of foods where they can avoid or can reduce the amount of that food. The other things we talk about the method is to give them a tablet. The tablets, sometimes we need them for temporary and sometimes we need them for long term. The tablets will reduce the acidity production by the stomach, and we call them proton pump inhibitors. And there are multiple in the markets. We can use any of them. But I usually and always advise the patient to minimize the dose and to use it for certain time, to use it as a bridge to control their lifestyle, to overcome these symptoms. The other thing, if we fail all these methods, we end up with advising the patient to do surgery. And by mentioning the surgery, also I have to mention one of the risk factors I missed before is having a previous surgery. You know, in Kuwait, there are a lot of patients who did actually bariatric surgeries like sleeve or bypass or mini bypass. Some of these patients do actually experience reflux disease, and the only option for them may be to correct them surgically.
So a lot of different methods, and one of the main ones you said is maybe changing the lifestyle and diet. That will help definitely, doctor, right?
That's exactly it. If there's anything I want the viewers to understand about reflux, reflux is a bad symptom. It actually stops some patients from doing their daily activity. And the best way, not the only, the best way to avoid these symptoms is to control your lifestyle, to control the risk factors, and to change your lifestyle, adapt healthy food, healthy life, exercise, sleep early, sleep enough at night. That will reduce the symptoms significantly.
Well, Dr. Ghanem, it was a pleasure to talk with you. Any last words or comments for the audience watching Hala Kuwait tonight?
Yes, I would like to actually congratulate everybody on this land, Kuwait, where we are celebrating our National Day soon this weekend, and this is the month where we all feel united together under the flag of Kuwait. So I would like them to celebrate with precautions, to take all the necessary precautions to prevent the spread of the coronavirus between our community. The other thing, I would like to thank you for having me on this show, and all the best for everybody.
Thank you very much, and well said. It was a pleasure to have you on our program, Dr. Ghanem.
Thank you very much, sir.
Thank you. Have a nice evening. We'd like to thank our guest.